This healthy living tip is brought to you by the Christ Hospital.
Heart disease can be a multitude of disease processes, including congestive heart failure, coronary artery disease. The major causes for coronary artery disease and congestive heart failure can include hypertension, diabetes, obesity, sedentary lifestyle, high cholesterol, smoking, and family history. The difference between men and women is often in the presentation. Presentation for women can be much more subtle than men. They may not often experience just chest pain or heaviness or discomfort. They may have more symptoms of fatigue attributed to indigestion, stress, overexhaustion, and that can really be a manifestation of their heart disease. The most important thing for women is to realize that they do need to take care of themselves. Women are often the nurturers of the family, and they take themselves last on the list. I would suggest that women put themselves first and make an appointment to speak to your doctor, surely if you're having symptoms, but also just for education. It's important to be preventative and to be proactive in your own health. Preventative measures are very important, and here at the Christ Hospital, we do take preventative measures very seriously. We can do a heart assessment on a patient. We can calculate their risk by calcium scoring. We can set you up with a physician to talk about what your individual risk factors are. The first step is to talk to your physician. The physician will help you identify what your risk factors are and then what appropriate measures need to be taken as far as further testing. There are many preventative measures that a woman can take to lower her risk for heart disease. One can include a more active lifestyle. For a more active lifestyle, we really recommend 30 minutes of moderate activity 5 days a week. In addition to that, weight training, even light weights, will help lower your body fat, which will make a marked difference in lowering your risk for heart disease. Healthy eating really needs to encompass lowering your saturated fats, your trans fats, and improving foods that are rich in antioxidants. We really recommend more of a Mediterranean diet in regards to lowering your risk for heart disease. Hypertension is more commonly known as high blood pressure, and high blood pressure is a major risk factor for not only cardiovascular disease but also stroke. Some of the things that you can do can be very simple to lower your risk for hypertension. You need to talk to your physician about what it is you're doing that may contribute to hypertension. Things like anti-inflammatory medications, over-the-counter medications you may be taking that can contribute to hypertension, and the salt in your diet. The other thing is active lifestyle. Lowering your weight will decrease your risk for hypertension as well. There can also be secondary causes for hypertension, other medical things that need to be evaluated to make sure that that's not contributing to hypertension. Quitting smoking is the #1 thing that you can do for yourself to lower your risk for heart disease. Quitting smoking is never easy, but there are a lot of treatment options now for smoking that we did not have in the past. Not only pharmacotherapy, aka drugs, that will help patients decrease their wantingness to smoke, but there are many programs out there sponsored not only through hospitals or physician groups, but also through the pharmaceutical industry that can help you quit smoking. The truth of the matter is that heart disease is the #1 killer of women over the age of 35. So if you think that this is a man's disease, if you think this is your grandmother's disease, you're sadly mistaken. There are many things that you can do to lower your risk for heart disease. 64% of women who present with their first heart attack present with sudden death. And when you look at those groups of women, 90% of them had risk factors they could have changed. So this is your disease, and you need to be proactive in your own health and taking care of not only you, but so that you can take care of your family.
Take the heart risk assessment online at thechristhospital.com.